This is episode number 28 of the Feed Me, Fuel Me podcast with our special guest, Dr. Matt Zanis. Welcome to the Feed Me, Fuel Me podcast. My name is Jeff Thornton, alongside my co-host, Michael Anders. Each week, we bring you an inspiring person or message related to our three pillars of success: manifestation, business, fitness, and nutrition. Our intent is to enrich, educate, and empower our audience to take action, control, and accountability for their decisions. Thank you for allowing us to join you on your journey. Now let's get started. We would like to thank our sponsor, FitAid. If you're serious about your performance and recovery, go with FitAid. FitAid is the perfect pre- and post-workout supplement product. If you're dragging pre-workout, FitAid contains natural ingredients to give you that boost and pick-me-up you need without the jittery effect. And if you're looking for recovery after your workout, FitAid has branched-chain amino acids or BCAAs, L-glutamine, L-arginine, vitamin C and D3, glucosamine, turmeric, CoQ10, and raw organic agave to accommodate the glycogen window and provide your body with a complete and clean recovery. Be sure to give them a try at lifeaidbevco.com, your local gym, or a grocery store near you.
Hey, what's going on, guys? Welcome to episode 28 of the Feed Me, Fuel Me podcast. Mike Anders here with my co-host, Jeff Thornton. And today our guest is Dr. Matt Zanis, physical therapist. Welcome, brother. How are you?
Doing well, man.
Good.
Excited to be here.
Right on.
Nice to have you, brother.
Yeah, can't wait.
You know, it's interesting how the universe works. I'm sitting in class with your wife, in typical PHX garb. And she's like, do you do CrossFit? I'm like, no, I just wear the shirts. And, after some discussion, we get around to the fact that I own PHX and blah, 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 blah. And she told me that you were in the process of probably still in inception mode of going private practice. Yeah. You were kind of waiting for your moment to pull the trigger on that. And so she gave me your contact information. I texted you right there in class, and we set up a meeting. And after a couple classes at PHX, you're now part of the family, part of the team that we break them, you fix them. And I'm already broken, so you're fixing me. And we've explored a number of recovery modalities, from some Graston to dry needling. That's brand new to me. I love it. And any other therapeutic modality. Your education and experience is so deep and so varied. You're like the Swiss Army knife of therapy. So it's awesome to have you on the team, and it's even better to have you on the show today. Why don't you go ahead and tell our listeners just a little bit about your background, where you come from, your athletic foundation, and how you kind of got to where you're at.
Cool. Yeah. My name is Dr. Matthew Zanis. I'm actually originally from northeastern Pennsylvania, so just about an hour and a half north of Philadelphia. Did my bachelor's in athletic training, though, at the University of Pittsburgh, where I also played baseball. I was a catcher. Took me forever to actually learn how to squat on my heels from all those years of being on my toes. But I eventually got there, and we can get into more about that later if you wanted to. My wife and I actually lived on the same block in Pittsburgh. Houses back to back of each other. I mean, we were the crazy exercise people that would probably get up at 5 o'clock in the morning and go running. We never met up there. I went down to Duke to do my doctorate in physical therapy, and she ended up being at UNC doing her master's. Met at a CrossFit gym at 6 o'clock in the morning in Durham, North Carolina. She taught this crazy fool how to actually do a handstand for the first time. And I was scared shitless to go upside down from having all these shoulder issues playing baseball. And she convinced me it was okay. And we'd roll out the big yoga mats and everything, the gymnastic mats, and have me go upside down. Believe me, fell a lot.
Sure.
But that's how we started talking. And went on a few dates after that, and now she's my wife.
There you go. That's interesting, huh?
But I knew that was going to be the fact after she decided to move around with me for all my physical therapy rotations.
Let me cut you off right there. What does that what does that roadmap look like?
So after you do a couple years of didactic physical therapy school,
Okay.
you have maybe a couple week rotations where you're in the clinic, but most of it is all the book work. Okay,
Mhm.
then they send you off on your rotations. It's time to actually learn how to actually be a physical therapist.
Okay.
So I went to Duke because of their ability to send you pretty much anywhere in the country. And my first rotation ended up being out here in Phoenix. I was with the physical therapist for the Cardinals
Alright.
down in, I believe that was Chandler, that
Uh-huh.
area. But anyway, she decided to move around with me for that. And we went from Phoenix, Arizona, all the way to Atlanta, and then finally back up to Pittsburgh, where I finished out my rotations. And I went back down to Duke for a couple weeks, graduated with the doctorate of physical therapy, and decided that we wanted to move back out here. We
Mm.
love the weather. We're sick of the snow in Pittsburgh, and want to start a whole new life out in Arizona. And it's funny how that all kind of works together because the physical therapist I was with the Cardinals, she ended up starting her own business, and that's what brought me out here. She brought me out here. So
Okay.
yeah, we decided to pack everything up, move out here, and then waited for about a year or two until I was actually comfortable enough to start my own thing.
Mhm.
Okay, and then that was kind of the impetus to it all. Like I was always kind of stuck in the middle of like, oh, I feel comfortable with this scenario. I've got a nice steady paycheck and all that, but I definitely knew I always wanted my own clinic because that's what I was passionate about. Like that was
Mhm.
always the biggest dream. I wanted to work in CrossFit because going back to, like I said, we met in a CrossFit gym, right?
Right.
And we wanted to always have that dream of having a CrossFit gym, yoga studio, PT clinic.
Right.
And this is kind of just the path that I've been on towards
Mm.
that.
Sure.
Yeah.
Sure. Just collecting the experience.
Yeah.
Yep. Awesome, man. So as far as physical therapy is concerned, especially with respect to
Mhm.
CrossFit, for the longest time, uh, probably '06 to probably 14, um, it was seen as people come see you guys because CrossFit broke them. So you're pretty much operating in almost an exclusively rehabilitative capacity. Now
Yeah.
you're at PHX and you're seeing a lot of people from a prehabilitative
Mhm.
standpoint and a performance optimization state of mind. Where is this shift?
So the shift comes from the old school physical therapy model, like you were just alluding to, where people went through sport and they beat themselves to hell until they were finally broken, and then they came to a PT to try and put out all the fires, right?
Hmm.
Well, now we're at this kind of crossroads where you're starting to see physical therapists who are really into sports, athletics, and training themselves, and becoming this almost this hybrid model of like a strength coach, physio, rehab professional. Okay, and from that, because we're so immersed in the culture, we understand all the movements that are going on. We understand what all the athletes are going through, and we can better develop a treatment plan and a rehabilitation strategy because we're in that environment
Hmm.
24/7. You know, we live it, we breathe it. We're in that community. Okay, and physical therapy has become so much more effective being able to take what manual skills that we learn, what diagnostic skills that we learn in school, and then apply them to the athletic setting because a human body is meant to move, right? I don't care what you do. If you're in yoga, if you're doing CrossFit, if you're playing baseball, swimming, it doesn't matter. As long as you have a movement practice, the body's built for that.
Hmm.
Okay. And what we found is that we take those manual skills, we go in, we analyze the movement, okay, we look head to toe of what's going on and pick apart that movement pattern of
Right.
what you want to try and improve. And 9 times out of 10, you could pinpoint exactly what's causing the pain based on how the person's moving.
Right.
Because, for example, you have somebody squat, it looks like shit. You don't have to be a PT to tell me it looks like shit,
Hmm.
right? But from here, we can use all that anatomy knowledge, that physiology knowledge, that strength training knowledge to go through there, and it's called regionally interdependent variables.
Okay.
So, say you have knee pain. Well, what we can find is that it's most likely either coming from your hip or your ankle,
Right.
right? And then we can go attack that with some interventions, whether it be manual therapy based with some joint mobilization, soft tissue work, the dry needling, the cupping, the myofascial release, what have you, and retest. Does that improve your squat pattern? Does it take away the knee pain? and it's just this continuum from there. Okay, and that's how we kind of roll with things.
Right,
Yeah.
right. And now that you're private practice, and something that's extremely interesting to me, because most of us get into the entrepreneurial space regardless of what our field is, because we think that there is a need that needs to be met in our industry that our expertise facilitates, and nobody in our immediate vicinity is meeting that need. So what is it in your industry that was missing, or where are the gaps in performance as far as PT as a whole is concerned, that you notice and that you now bring to the table on your own, where you may or may not have been restricted or inhibited as an employee or renting space in somebody else's clinic?
And that goes back to the whole old physical therapy model, right? Where you are expected to see 3 or 4 patients an hour. You're getting crammed through the door, and you're maybe with them for 10, 15, possibly 20 minutes at a time. What kind of meaningful work can you get done there, right? Like, what kind of interventions can you get done, hands-on or exercise related, to get that person better? When I work on you, I'm with you for almost an hour and a half.
Right.
All right.
Yeah.
That's the kind of the care that we need, and that's the $1 million question, right? So, what is bridging the gap between rehabilitation and physical therapy and performance, getting back into the gym? Okay, because what happens is that old model, people get sent to PT. They go through maybe 4 to 6 weeks as a standard, 2 to 3 times a week, and they're like, okay, I'm out of pain now, but what do I do to get back into clean and jerking or snatching? And that's kind of where I start to shine, because I know what's required to bridge that gap, whether it be from a mobility, a motor control, or a stability standpoint. Okay, so just because you went to PT and then you got, okay, well, I have my full internal rotation of the shoulder, I'm good to go. No, not really the case. Can you control it, right? And that's where the stability component comes in, right? So you got to have the mobility, the capacity, the specific joint to actually go through a certain range of motion. You got to have the stability of the joint to actually be controlled through that range of motion. And then where it all comes together, the snatch or the clean jerk, this is motor control.
Right.
Putting it all together, all the joints and muscles and tendons and ligaments and fascia kind of coordinating as one whole unit to execute a specific movement pattern. Okay. And that's where I go into developing all kinds of specific, unique rehabilitation programs that kind of piece and link all those together to get back into the gym, back into the community, back into doing what you love.
How do you teach your clientele, so to speak, like somebody who's like relatively new to your practice, to in a way trust the process? Because I find a lot of times when I first got my knee surgery, it was you go through the PT process like you're mentioning, you get in your rehab period, and then you sort of fall off the boat after you get done with your physical therapist, And how do you condition the person to continue to come back and sort of, understand their body to a point to where they're like, okay, I'm lacking in these areas. How do I improve? How's that look for you when it comes to like teaching people in their industry or teaching people outside the industry to understand a little bit better?
So it all comes back to 2 different things. You have to get an initial buy-in, and then the majority of my job from there on out is education, right? So if you came to me with knee pain, I got to show you then and there that I can make some kind of reasonable change to it, and that develops the rapport and the trust that you have in me to take you the rest of the way. Okay, so I'll make a change in your knee pain, whether it be from improving the length of the quadriceps, improving this segmental joint mobility, what have you. Okay, and then we go from there into building these educational sessions. I like to call them like discovery sessions. Okay, and that's where I take you through and I show you how to feel certain things, feel certain movements. Be like, oh man, my knee's definitely not bending the way it should be. There's something wrong.
Right.
Well, then I teach you some basic diagnostic tests. There's like, oh, is it coming from my ankle, coming from my hip, low back? And then we kind of go into that and tweeze it out with you along the way. The national average for physical therapy visits, you know how many it is?
No.
It's 12. 12 visits, okay, before any kind of reasonable change is made.
Wow.
The model that I like to work in, getting people better in 3 to 4 visits. And that doesn't mean that you're totally 100% cured.
Right.
There's a continuum, of course.
Right.
But you've made it 70, 80% of the way. Now let's kind of let the little birdie fly from the nest, give you some things to do. You go on your way and you report back months, weeks later.
Yeah.
Okay.
So would you say what separates you in your industry is that a success case to you looks like your client doesn't come back as often as they normally would in a normal
Yeah.
PT practice?
Yeah.
Is that sort of like your
As,
success case?
as much as I love my patients, I don't
Uh-huh.
want to see you in there every single week.
Right.
Mhm.
Okay. Now that doesn't mean that you can't come in for just some basic like massage work and whatnot, just for some recovery standpoint. But it's a waste of the healthcare system. It's a waste of the model. It's a waste of your time as a patient to be coming back, driving to the gym or the clinic every week, 3 times a week for an hour.
Mhm.
You look at that though, 3 times a week for an hour is 3 hours. That's only about 2 to 3% of your week. Okay, so 2 to 3% of your week, I'm not gonna fix you 100%. You got to be doing stuff other 24 hours of the day, or 22 hours of the day, 6 days a week, 7 days a week to make yourself better. It's all about empowerment.
Mhm.
Right.
Okay, you got to trust in yourself. You got to trust in me to take you there, but you got to be willing to do the work as well.
Right.
Right. I like that.
And I think that's where you and I connected, was because I feel the same way about training as you do about therapy, in the sense that our job is not necessarily to hold your hand.
Mhm.
Our job is to educate and empower you enough to the point where you would now have enough confidence and know-how that you only need to see us for tweaking and optimization,
Mhm.
but you can go out and do the work and do a good enough job on your own to facilitate your own progress, right? And one of the things that I've noticed about you is you'll do your consult, um, make whatever diagnoses need to be made, and then uh, you're really diligent in creating the homework for your patients. In that some of our members have even come in with these packets, with pictures and descriptions and sets and reps and all that kind of good stuff of, um, you don't need me for this, but you need to get it done. So again, I'm going to empower you
Mhm.
with this packet.
Right.
Go do it. I'm not going to insult your intelligence and tell you what a squat is, and at the same time, I've shown you everything that you need to know for you to get it done.
Mhm.
And once you've done it for X amount of time, we'll check back in, and then we'll tweak and optimize and repeat that process.
Right.
It's the same thing that we do on the training side when we're talking about achieving individual goals. If you're not stringing your pull-ups together, you know what I mean? There's certain things that we can do above and beyond simply taking classes to strengthen that particular movement. But at the same time, you have to be willing to do the work,
Mhm.
Mhm.
and I've not seen a physical therapist that goes above and beyond like that with each and every patient.
Mhm.
And I think that's a lot of what you bring to the table that sets you apart.
Yeah.
Because I've been through the rehabilitative process a number of times with AC separations. I mean, shit, you saw my last MRI. It was fucking horrific. You know what I mean?
Yeah. Yeah.
And so that's the nuance, the higher standard of
Mhm.
care that you're talking about, that is almost non-existent in your industry right now. Because especially when you're talking about um, the insurance game,
Mhm.
it's like, well, shit, how many billable hours can I accumulate to maximize that income? And that doesn't necessarily do your patients justice. I mean, would you
Yeah.
say that's accurate?
That's very accurate. Yeah, you just fall into that trap of the healthcare system where the insurance companies start to dictate how long, how many treatment sessions I could have,
Mhm.
what could I do with you.
Mm-hmm.
Some of them even get to the point where they say, "Oh, we're not going to accept these manual therapy codes anymore." So I'm like, "Well, what do you want me to do now? Do you want me to lie to you and say I'm not, not doing any manual therapy or whatnot, and then just
Mm-hmm.
document that I did all exercise, or like how do you want me to go about that?" It's a
Mm-hmm.
you're stuck between a rock and a hard place with it, and and that's not to say that all insurance is bad, obviously, but the insurance companies, to be honest with you, they don't see physical therapy as a good rehabilitative standard of care. They'd rather pay for the drugs, the narcotics, the surgeries, and and all that because they don't see our outcomes as being positive.
Mm.
And that's a huge issue,
Sure.
right? So what it comes down to is now you're going towards that surgical route, you're going towards the medication route because it's being paid for.
Mm.
Okay, and that's the thing. The insurance companies and most of the community at large, they're not used to this new wave of physical therapy and how it's being ran.
Mm-hmm.
This strength coach physio, this manual therapist, these new modern physical therapists, and that's just going to take time.
Sure.
Honestly, it's going to take time to get back to the physicians, which ultimately are the gatekeepers to the insurance companies,
Right.
and turn this model around. Because right now, I believe that the funnel is it's upside down, right? So usually you go see your doctor. I mean, doctors get 50% of all musculoskeletal issues in the U.S. Okay, yet your PCP is not equipped. I mean, they're smart guys, but they're not equipped to handle.
By doctor, you mean MD?
MD, yeah,
Okay.
MDDO, yeah,
Got it.
that's another terminology phrase that's
Sure.
a soapbox I can get onto,
Okay.
but because most physicians don't. There we go, physicians. That's a
There you
great
go.
word to use. They don't really see us as doctors as much.
Okay.
Okay, so you go to your doctor with low back pain. Okay, they're gonna do a number of different tests. They're gonna do MRIs, X-rays, what have you. Give you the pain meds and muscle relaxants, and then you're gonna get filtered down eventually. Okay, now it's time to go to physical therapy. Well, why not bypass all that? Go see a physical therapist first, and then if you really have seriously something medical going on, we'll send you to the doc. We're equipped to do that. We get trained in an extensive amount of medical screening, pinpoint, okay, this is something that might need surgery, or this is a medical red flag that we need to refer out for.
Mm-hmm.
Okay, but going to the doctor first and having to go through all the costs of the medical system, paying for the MRIs and going to the insurances and all that, it's kind of reversed. It's the last backwards, in my opinion. Okay, they could actually take an MRI, an X-ray of 100 people, right? Jeff will get an MRI of your low back. I guarantee you, with all the years of weightlifting you've done, there are disc protrusions, herniations, osteophytic formations, facet joint arthropathy, you name it. There's something going on with there, but you're not in pain right now sitting here, are you?
No, not
Yeah.
at all.
86% of people will come back having all that pathology in the back, but be pain-free. So you can't tell me that the results coming back from the MRI are causing the person's symptoms, correct?
Right.
Right. So come back to the physical therapist. We refer you out if you need it, but I can fix the majority of those cases
Mm-hmm.
when it boils down to it. Yeah. And then that's where working with you as the strength coach or the CrossFit coach is so ideal from a physical therapy standpoint, because the patient isn't going to get away with me just doing massage, doing manipulations, doing the dry needling. There's a lot more to it than that. Now, those are means to an end. Don't get me wrong; they're really effective and they're game changers in the rehabilitation arena. But it's mobilizing the tissue, producing more range of motion, and then loading it and stressing it through weight training that makes the permanent change. Okay. So you're not going to make a permanent change just by me cranking on your hip.
Right.
Okay. That's why anytime you see me work on you, we're going to do a joint mobilization. I'm going to have you activate it in that newfound range. Then we're going to go through a movement pattern like a squat or a loaded lunge or something like that. Or kettlebell goblet squats are great exercises. I love using those to retrain that movement pattern. It's the only way the human body responds is by stressing it.
Sure.
And that's just not even in the physical. I mean, that's mental as well.
Right.
Okay. It's actually something called Wolff's Law. So your body adapts to the amount of stress that you place on it. So if we keep stressing you in a really bad movement pattern, your body's going to adapt and you're going to really suck and squat wrong for a really long time. But if we can give you the capacity to move better and then train you in that pattern,
Right.
that's where you're going to shine. I mean,
Sure.
CrossFit, physical therapy, it's a lifelong thing, right? We're not in a sprint here.
Right. Right.
Strength training, getting better at being movers, as being human beings. We got our whole life to do that.
Right.
And that's kind of when it boils down to, we got to be asking the question to clients, patients, what have you. It's like, what's your goal? What are you really training for? If you're in CrossFit to be a CrossFit competitor and go to the games, by all means, beat your body to shit, because that's what you need to do. I'll help you get through it from a recovery standpoint. But if you're just Joe Schmo off the street who's just trying to get physically fit, look better naked, be more attractive to your spouse, what have you, have a higher self-esteem, this is something that you're using as a way to get there. It's not the end all be all.
Right.
Okay. So if you go to pick up a bar off the floor to deadlift, but you've got shitty mechanics and you're around your back and can't actually get there to pick it up, you've got no business doing it, right? There are other ways to train and get that stimulus than going through a movement pattern poorly.
Sure.
Okay, and it goes the same for something like kipping pull-ups. Like, what do we really use kipping pull-ups for? Right, metabolic conditioning.
Right.
It's load,
More volume.
more volume.
Mhm.
All right. If you don't have the overhead mobility of the shoulder to go through that, why would you want to put 10 times body weight through your shoulders
Right.
trying to kip?
Mm-hmm.
Let's work on the strength of a strict pull-up. Let's work on the mobility, and then once you own that capacity to get there, now we can talk about load and speed and power development. Okay.
Right on. So when we're working together, having gone through the post-op protocol twice now, and even looking at my last MRI, one doc recommended a total knee replacement already at 32 years old. That's how
Damn.
ridiculous this left knee is. Where there's an adage out there for those of us that have been through the process once, twice, three, four times, that the rehab never once you've experienced that kind of trauma, the rehab never stops. So where do you, as a physical therapist, a doctor of physical therapy, take the training wheels off and kind of give your patient, your client, do you ever stop checking in? I mean, I know you're in-house with us. You're a member of the family now, so it's a little bit different because you see your people every day, in passing as they're, moving through classes and you're working on other people. But for your people that are, come to PHX to be treated and then disappear for the other 23 hours of the day, at what point does that relationship ever stop with you?
In my opinion, it really shouldn't. Now, that doesn't mean you're coming back to see me every couple weeks or every month, but treat it like the dentist model, right? You go see your dentist twice a year to make sure your mouth is functioning properly, right? That's such a small part of your body,
right,
to get checked up on twice a year. Yet people, they don't care the way the rest of their body's moving. Like,
Mhm.
why would you not go see a physical therapist? I don't care what it is, if it's a PT, a chiro, massage therapist, somebody who understands human anatomy and movement. Even a well-trained CrossFit coach, an exercise physiologist, they know movement very well. Go see somebody like that and get a checkup, man. Just make sure your basic fundamental movement patterns are going correctly. Okay. And when going back to the question about taking the training wheels off, it's the question I hate it most going through PT school, and it's the answer is it always depends, right? It depends on the person, it depends on the injury and what they've got going on. Typical ACL stuff, you're looking like you're going to be probably running in like 16 to 18 weeks. At that point, that's kind of where we start to take the training wheels off and you kind of go do your own thing from an ACL standpoint.
Right.
Okay, but that's obviously different depending on the body part and the surgery and or the injury itself.
Sure.
And it goes along the same way with somebody's coming to see me for just my shoulder kind of hurts. I don't think it's injured yet, but I just want to make sure it doesn't get any worse, right?
Sure. Yeah.
So that's where I start to implement a bunch of corrective exercises.
Yeah.
Right. But corrective exercises are just that. They're meant to be implemented in short doses as a corrective exercise, not to be done consistently every single week for the rest of your life.
Yeah.
Okay. Let's retrain it. Like, say you need shoulder stability at the end range of shoulder flexion when you're jerking overhead.
Yeah.
Well, let's train that movement pattern. Let's train that stability in the shoulder. And once you get there, you don't need to be doing the little things that I give you, like a landmine press or a bottom up kettlebell press. Because once you attain that, you own that. Now we could add that speed, load, the power development into there, and you should be good to go.
Right.
Okay.
That's interesting. Yeah. How and when it comes to sort of like the method of, I don't know, dry needling, massage therapy, you see a lot of times like where you look online and the hot YouTuber go and say, "Oh, I'm doing Graston," and everybody all of a sudden wants to do Graston. But how do you know if that type of therapy is good for you or that certain element that you're going through at the time? Because people they're really not knowledgeable about what they need. How do you diagnose something and make them and decide what type of therapy to use on them at that point.
Right, right. It goes back to the whole Olympic thing when Michael Phelps had all those
Right, the cupping.
the
The
cupping
cupping,
done,
yeah.
right? People are like, oh, this is cool stuff, man. Shit, cupping's been around for thousands of years
Yeah.
with the Chinese using glass and fire
Mm-hmm.
to create that suction effect. It's just like the new hot topic, right? When somebody comes to see me, they're never going to get X, Y, and Z because they have this type of shoulder pathology or this type of knee pathology. There are some people that just, you don't need to dry needle.
Mm-hmm.
People sometimes will come in and like, I want the dry needle in. Do you think it's going to get you better?
Yeah.
Right? Yeah. Well, in that case, if you think it's going to get you better, I'll freaking dry needle you. I don't care.
Mhm.
Right? It's not going to hurt you.
Right.
But that's where it comes back to the mental aspect of it. From a physiology, anatomy, musculoskeletal standpoint, I'm looking at movement patterns, right? And I'll do whatever I can do to improve that movement pattern and that joint capacity. Okay. The soft tissue work through the Graston or the A-stim or any kind of like hot grips is another common one out there. The cups, the dry needling, they all work under similar mechanisms.
Sure.
Okay, where you're trying to increase blood flow to the muscle, you're trying to get blood flow to the joint, because through that you get more oxygenation, you get more nutrients, you get more chemical mediators like insulin-like growth factor, increased growth hormone, the whole 9 yards. Okay, but there are different ways to do it.
Mm-hmm.
All right, and if you come to me, say, with knee pain and a limited quad length, right, you can't get your heel to your ass. Well, there are multiple ways we can go about it. We can try Graston. I usually go from the least invasive one first, and then we kind of work our way up if we need to go there.
Right.
Okay. So 9 times out of 10, I'll start with just some basic joint mobilizations using my hands and some soft tissue work. Give you a basic little home program to go try, and if you're making progress with that, we're not going to change it. We don't need to go and dry needle your quad just for the sake of dry needling your quad.
Right.
Right.
But you got such a mixed bag of modalities,
Yeah.
right? Let's work down the list because even though they facilitate a lot of the same stuff, they're different for a reason.
Right.
So, what are the specific differences in each modality? Let's just start with cupping first. What is cupping designed to do?
So I'm actually going to lump the cupping and the instrument-assisted soft tissue stuff into the same category.
Instrument-assisted being Graston?
Graston
Okay.
or A-stim, whatever tool you want to use out there. You can use a package of a spoon. That works just as well.
Sure.
Some of these tools cost thousands of dollars. And It's absolutely ridiculous.
And you can use silverware.
You can use silverware.
Okay.
Yeah. not even the fine China silverware. Like
right.
the crappy stuff you get
from
IKEA,
the butter
works
knife
just
from
as well.
Walmart.
Okay. Just don't use a serrated edge.
Okay.
But the cupping and the instrument-assisted stuff, they work on the same mechanisms because they're more so superficial.
Okay.
Okay. So you're going to work on the skin layer.
Mm-hmm.
You got fat, fascia, muscle.
Okay.
And that's about the range you're going to work in with the soft tissue stuff like that. There is deep intramuscular fascia that surrounds all the different muscles in your body, like between your quadricep tendons and everything. And I explain it to people, it's kind of like the chicken breast, like the skin on a raw chicken breast. That's kind of what the fascia is in your body.
Right. Okay.
And it's a sliding surface.
Sure.
Okay. So when I scrape your quad with a plastic or steel tool, we're working on that sliding surface between the skin, the fascia, and the muscle.
You're trying to decrease friction?
Decrease, essentially. Yeah.
Okay.
So if you grab the back of your ankle,
Yep.
right where your Achilles tendon is, you should be able to pull that skin off the Achilles tendon.
Right.
Right. People come to me with such crappy ankle range of motion, and you could just work on that sliding surface of the skin and the Achilles tendon. You're going to improve it by a number of degrees.
My left one's sort of tight.
Yes.
Okay. Gotcha.
So that's what that stuff is kind of working on. You're bringing blood flow to the area.
Right.
You're getting the superficial micronutrients to it as well.
Gotcha.
The dry needling, on the other hand, is obviously a deeper form of intervention. Okay, we're sticking needles through the skin, down to the muscles, sometimes the ligaments, the tendons, and right next to the bone. Okay. The whole idea with the dry needling is there's a few different mechanisms. There's 3 main ones. Okay, so you insert the needle in. It's mechanically going to create a little bit of tissue damage, right?
Mm-hmm.
This works really, really well on areas like attachment sites of muscle to bone.
Sure.
Okay, so think like a lateral epicondylitis, like a tennis elbow type of deal. Yeah. We sit there and we pick it to induce a little blood flow, and that's when you get all that influx of blood flow and oxygen and nutrients.
So through dry needling in this first stage that you're talking about, you're purposely triggering an immune response.
Purposely, yes.
Okay.
Yes. The other mechanism is more of a nutrient chemically mediated mechanism.
Okay.
So at one point during the treatment session, I'll take the electrodes off that we use and we spin them.
Right.
Correct. So what we're doing is we're winding all the tissue up around the needle. So the myofibrils of the muscle, the fascia, the connective tissue. Okay. And that takes the muscle tissue. If you were to biopsy it and look at it under a microscope, it's like a bunch of jumbled up wet spaghetti.
Right.
Okay, you wrap it around the needle, it pulls the myofibrils in the muscle into better line of pull so they can contract better.
Okay.
So you improve the resting length of the muscle.
Okay.
Okay, so that's why one of the proposed mechanisms is increase range of motion
Yeah.
for dry needling, because you're actually lengthening it and putting it in a better position to contract.
Got it.
Okay. Now,
Does that also increase contractility? Okay.
Yeah. And then when you do that, now all the cells are lined up next to each other. Okay. And you get increased what's called mechanotransduction. So mechanotransduction is how the cells actually communicate with each other, how they transport nutrients back and forth. So you're improving the ability of the cells to do that, and therefore influx with those chemical mediators of the growth hormone and all the other nutrients and oxygen, stuff like that. And the last one is a bit more complicated. Okay, this is the neurophysiological response to the dry needling, and that's where we hook the electrodes up.
Right.
Okay, so we're forcefully making your muscles kind of contract and twitch for a length of time, usually like 10 minutes. Okay, and the whole reason to do that is because muscle tissue is painful and dysfunctional because of an excessive amount of a neurotransmitter called acetylcholine. Okay, acetylcholine is what gets released from your spinal cord, travel down the nerves, and gets released from the nerves into the muscle to make it contract, essentially.
Right.
There's a junction called the neuromuscular junction between the end of the nerve and the muscle. Okay, acetylcholine gets released, it makes the muscle contract, it's supposed to get dissipated back into the body.
Right.
Taken back up. However, what they found, if they take that biopsy piece of muscle and do a chemical analysis on it, the acetylcholine is all jumbled up in that neuromuscular junction. It's never getting released. It's kind of just sitting there.
Okay.
So now your muscle is under a constant state of low-grade contraction. So it's never releasing. That's why muscles feel tight and painful. Okay, so the inserting the needles into there, sometimes you get a local twitch response.
Yes.
Hitting a trigger point.
Yep.
And that's kind of like a release of acetylcholine.
Okay.
But making the muscles contract with the electricity, the stimulation unit, forcibly makes that muscle relax and release all that chemical out of there.
Wow.
So how is that stage 3 of dry needling with the electrodes and everything different from E-stem with sticky pads?
Right. So the sticky pads with the E-stem are obviously very superficial.
Right.
Right. You're kind of targeting a broad-based area of muscle tissue.
Okay.
The needles are pinpointed exactly into the structure that I want them to go.
Got it.
And we're forcefully making that specific muscle contract or be stimulated or get blood flow to that area. Okay. It doesn't mean that the superficial E-stem isn't doing anything. It's just not localized.
Got it. Okay.
And
it's different waveforms too.
Is dry needling similar to acupuncture?
Oh yeah, let's go.
We're really gonna get on this soapbox now.
Oh, geez. What? So seriously, what are the differences? Because when you talk to a naturopath, and you use those two terms synonymously, either you guys or they get super offended and immediately want to tell you why they're different and which one's better.
Yeah, it's like we're putting the gloves on, we're going into the ring box.
Right.
So here's the analogy I like to use, right? So just because you know how to operate a calculator, does that make you an accountant? No, it doesn't. Okay. Just because I use so-called, I'm using air quotes here, acupuncture needles, doesn't make me an acupuncturist.
Sure.
Okay. So the acupuncturists usually only go a few centimeters into the skin. So never break the dermis of the skin and go down to the muscular tissue.
Yeah.
Okay. They believe in the cheese and the meridian and changing energy flow.
Right.
Things like that. And that's a very much an Eastern medicine approach.
Correct.
Dry needling is based in a functional anatomy Western medicine approach.
Got it.
Okay. So now we're using more structures to change function, whereas the acupuncturists are using more cheese and meridians to change energy flow.
Got it.
Okay.
Interestingly enough, though, we developed the dry needling protocols and stuff off of the acupuncture literature.
Sure.
Okay. They're smart guys.
That makes perfect sense.
You look at all those acupuncture points, they line up very, very well with structures in the body.
Right.
However, they just didn't go deep enough to hit them.
Okay.
Okay.
Got it.
That's the gist of the
Sure.
main difference between them.
Nice.
Yeah, and the acupuncturists do sometimes use the
Yeah.
electrical stim
Well,
stuff too. But
it's so funny because this to me, your description of the Eastern method versus the Western method and their inclusivity to me is what dictates whether or not you're a master of your craft or not.
Mhm.
Being able to not only articulate the difference of in a similar modality, but also not label it as right or wrong,
Mhm.
or even necessarily different for
Mhm.
that matter. It's more so this is how they do it, and this is how we do it.
Right.
And both can accomplish the same goal just through a different channel.
Mhm.
And it's very rare, very, very, very rare. It's almost like I think talking with you and dry needling versus acupuncture is the same as, uh, talking about CrossFit versus bodybuilding. You know what I mean?
Yeah.
In the sense that if you talk to either camp, both will tell you what's wrong with the other one
Mhm.
in 99% of cases. And then every once in a while, you meet that rare bird like Taylor Dane,
Mhm.
who is versed in both
Mhm.
worlds and can articulate the differences, but also the similarities, and also acknowledge that one, a lot of the time, either it was birthed from the other or can help facilitate
Mhm.
the other, and not get on your soapbox about it.
Right.
So
Right.
that's huge, and it speaks a lot about you
Mhm.
as a professional and a master of your craft, in that you do have the ability and the awareness to do that.
Right.
You know.
I think that's fantastic too, because this is the whole rehabilitative setting, whether it be a naturopath, a chiropractor, an acupuncturist, a PT, it really doesn't matter. We're all on the same team.
Mm-hmm.
We're trying to get people better, getting them to move better and live healthier lives,
Right.
right? And that's where it comes back to having this abundance mentality, because there are enough people to do CrossFit from your standpoint, plenty of gyms to go to, right?
Mm-hmm.
There are plenty of PTs out there, plenty of chiros that I know and that I trust. What does it matter if you go see them or me? Like you're gonna be able to find a practitioner that you trust and you like, and they're gonna get you better,
Right.
and that's all what it boils down to, right?
Mm-hmm.
Mhm.
Yeah.
Interesting.
Mhm.
I like that.
Yeah. And then back to the whole like the bodybuilding CrossFit thing.
Yeah.
I
Because you've
did.
done a show.
I've done. Yeah.
So this is super interesting because
Yeah.
we've all played collegiate athletics.
Right.
We've all went from that to bodybuilding, and now sit here at this table on a podcast and live the CrossFit life.
Right.
How has that transition been for you as a professional? Because I know what it's done for me as a professional, and being able to take the performance parameters of a collegiate football player and the ability to turn things on, turn things off, and use different
Mhm.
muscular structures to facilitate to overcome
Mhm.
local muscular endurance deficiencies, and bring that into the CrossFit world
Right.
to make me a better CrossFitter,
Mhm.
which in turn has made me a better coach.
Mhm.
You know, I can tell what deficiencies you're going to have when I ask you what your athletic background, and you tell me you run marathons versus, I played baseball versus I played football versus I'm making the transition from bodybuilding. You know, how does that fit with regards to your professional development?
Mhm. Well, that's all pattern recognition, right? Recognizing all those different forms of activity and what kind of deficiencies they're going to have.
Mm-hmm.
That's one of the characteristics of a true master coach, right? Is being able to pick up on that, because you could you could tell pattern recognition, and you can at least have a framework to go off of.
Mm-hmm.
Okay, going back to the whole kind of transformance that we've all had from sports to bodybuilding to CrossFit. I can tell you guys a little story that I have not actually told in a very, very long time. Being in undergrad and getting into the whole strength conditioning thing and doing the bodybuilding stuff, I fucking hated those CrossFitters, man.
Oh yeah.
I did.
Yeah.
I think it was just getting started. It was like 2007, 2008,
Mm-hmm.
and I was like, these assholes are crazy. They're doing freaking pull-ups and like this isn't right. Like I'm in athletic training school. Their shoulders should not be moving like that.
Mm-hmm.
No. So I despised it for a couple of years,
Right.
and I still firmly believe that was just a stepping stone into where I am now, because that allowed me to go through the whole bodybuilding phase and build up the tendon strength joint by joint from those local muscular contractions and overload, right? We go back to that Wolf's Law
Mm-hmm.
that we just talked about earlier, stressing the body to adapt. Well, I've built up that adaptation in all my joints from doing a lot of single joint movements or just straight up deadlifts, straight up squats, straight up presses to allow me to come into the CrossFit realm and have more robust tissues, right?
Right.
To handle that higher load. And that's one of the things that I think is missing from the CrossFit realm is there's not enough assistance work going on.
Sure.
Right?
Right.
Like there's a lot of this beat you up mentality of going through different watches for the hell of sweating. And that kind of goes back to our whole talking about what is your goal, right?
Right.
So it's kind of like a diversity thing. Like you
Right.
need to be able to have an assistance day to work on those accessory muscles and those accessory joints that you're not using constantly in the CrossFit realm.
Right.
Does that make sense?
Sure.
Yeah.
Sure.
From your from your perspective, where do you see the breakdown between compare like a CrossFitter to a bodybuilder when it comes to mobility issues that they have? Where do you see they have similarities, or where do they differ? From where they're having troubles in their body.
Bodybuilders as a whole, big muscular dudes and gals, right?
Yeah.
So you're going to be locked down pretty much everywhere. Okay. You see a lot of bodybuilders adopt more of a powerlifting mentality when it comes to building strength. However, they also do a lot of the hypertrophy phase, those rep ranges of like 12 to 16 to get that growth.
Mm-hmm.
Okay, so that tends to really engorge the muscle and make it hypertrophy to the point where you're not going through full ranges of motion like we do in CrossFit, full functional ranges to actually work that range of motion.
Mm-hmm.
Okay, so you're kind of, I don't want to say scarring down, but you're training your nervous system to work in a shortened range. And your body's going to just do what it is adapted to do. If you're constantly doing biceps curls all day long and bench press, yeah, you're going to have some pretty bad rounded shoulders and limited shoulder extension because you've worked the front of your body the entire time.
Right.
Okay. When it comes to CrossFitters, what we see is, and it depends on the level, of course, but if you take the average CrossFitter who's doing, 4 to 5 workouts a week, it's going to come down to limited shoulder range of motion, and limited hip internal rotation and extension. Those are the two main issues. Those are the biggest injuries that I see.
Sure.
We do a lot of pull-ups, a
Right.
lot of pulling motion, a lot of lat engagement.
Right.
Okay. Also, with the butterflies, we do a lot of teres major and not a lot of lat. So you see people develop like really, really big under the armpit, but they don't have those big cobra lat tendons like the bodybuilders have.
Sure.
The bodybuilders go through that
Mm-hmm.
big lat range, pulling down the
Mhm.
scap and everything, whereas the CrossFitters are kind of in this shortened range of motion.
Right.
So a lot of pulling, a lot of internal rotation. Now we can't really go overhead or go into extension behind our back because it's just so tight and stuck in this like almost like Kelly Starrett uses a term called douchebag shoulders,
Mm-hmm.
right? Kind of all rounded forward
Yeah.
like that.
Right.
Tends to happen in the CrossFitters. And then
Mhm.
also with the hip component, a lot of people are limited internal rotation. I was one of them as well.
Mm-hmm.
Okay, from playing baseball for a number of years, I was turning one way. Okay, going back to the whole adaptation, I had excessive internal rotation on my left side and limited on my right.
Sure.
Okay, so it's just going back to that whole thing of trying to pick apart that movement pattern and find out what asymmetries you maybe need to correct
Mm-hmm.
and give a plan to go and attack it.
That's
Right.
interesting.
Yeah.
Because even nowadays, like when I first started CrossFit, I know Durs can remember. It's like coming over from football, you used to wide base stance, get ready, explode. Then I went to bodybuilding, and you sort of switch your stances to like a more narrow focus because you're trying to build the
Right.
sweep. And when I came into CrossFit, Durs, I remember we did it was a squat session, and Durs like, you squat like a bodybuilder.
Oh
And he's
yeah,
like,
man.
yeah, and he's like, you just need to you need to widen your stance more.
Mhm.
And like, it took me the longest time to finally get my stance to where it is now. And like, I feel like I have like limited hip mobility because, like you said, my
Yeah.
body was so adapted to that type of training.
Well, in the bodybuilding arena, unlike CrossFit, where we don't have machines to give you that stimulation,
Uh-huh.
you really have to optimize movement patterns in the CrossFit setting to get in uh, just a single squat sesh what you get from a bodybuild on leg day with your back squat, your leg press, your leg extension, your leg curl. So you're compartmentalizing musculature and joint movement in the in the bodybuilding space
Mhm.
that doesn't occur in CrossFit, where we're asking you to move across, use nothing, almost compound movements almost exclusively
Right.
in everything that we do, to give you that same performance,
Right.
that same aesthetic, because you can isolate, you can just squat. And I'll go on the record as saying this: you can just squat, and if your movement patterns are sound, you can trigger the same kind of stimulation and activation and the same results from only back squatting that you would get from an entire hour and a half dedicated to leg day,
That's interesting.
assuming that you have optimized movement patterns. Because
Mhm.
now, and you can speak to this, Matt, when you've optimized a movement pattern, everything's firing the way that it should. So you're getting maximal muscular contractility. Where if you're deficient in any movement, right, now you have to rely on the machines to get your quads to turn on the way that it's supposed to, get
Yeah.
your hamstrings to fire with a hamstring curl. When in actuality, when you change directions in and out of the when you go ass to grass in your squat and you change direction from down to up, your hamstring is on and all the way on, all
Mhm.
three heads when you're doing it correctly, as well as your glutes and all that other stuff.
Uh-huh.
If you're deficient in your movement pattern, you can't readily do that in a single movement. So you need all the extra stuff.
Right.
And that deficiency will show up to me in my clinic too.
Mm-hmm.
And then if you're constantly sore and beat up in a certain area, you're probably moving wrong,
Sure.
right?
Mhm.
So why not have the conversation about optimizing that movement pattern
Mm-hmm.
and retraining that central nervous system? Because then it goes back to the whole beginning of, you don't need to come see me all the time then,
Mhm.
right?
Right.
You're naturally gonna optimize your own movement and then therefore create all that muscular
Mm-hmm.
and actually the central nervous system too, so neuromuscular adaptation
Right.
to where you're moving well and your body's not going to fight you.
Sure.
Mhm.
I mean, it
Okay.
goes back to my personal training days when I would have the 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 big muscular dude in the gym seek me out for private training, and I'm like, okay, what do you want to? When I was still bodybuilding, like, oh, I want to do everything just shy of getting on stage.
Mhm.
Okay, cool, I can help you do that. But I need to see how you move because I need to know where we're starting to get you where you're going. So my first test would be, what's your max squat? 315, 405, whatever.
I'll talk about the
You know,
bench
and
there.
and there's nothing in the middle.
Yeah.
You know what I mean? So I'm like, okay, build up to it. You've got some size on you, so you've obviously spent some time under tension. I trust that, but let's see how well you move. I put them I put them under the bar. They've got 3 plates on there, and sure enough, they hype themselves up. They strap that bar across their traps. They step out, and it's a quarter squat,
Yeah.
and they'll do 10 and be fucking excited about it. And I'm like, nope, we're starting from square one. Rack the bar, take it down to 135. And I'm like, I want you to sit. I want you to try and touch your heels
Mhm.
with your butt cheeks. And we'll do 3 sets of 10 like that. And I've had more dudes puke and be sore as fuck for, like, no shit, 4 to 8 days
Yeah.
doing it correctly, because now you're using all of the musculature instead of just pieces of it and then going to use all that other shit to activate the rest,
That makes a lot of
and
sense.
calling it a workout.
Right.
You know.
And that's where it all comes down to the posture, right? So three of the pillars that I tend to live by are posture,
Mhm.
position, and mechanics.
Right.
And from that, we get optimal movement.
Sure.
All right. So from your example of squatting, number of things could be relating to why they're only squatting quarter depth. Okay,
Right.
it could be an ego thing, the mental aspect.
Sure.
Right.
9 times
Or
out of 10 it is.
gotta put the weight on the bar.
Yeah.
It could be because they have those joint limitations
Sure.
and they can't go down that far.
Mm-hmm.
Or it could actually be a motor control issue where they got the range of motion, but they're just not connecting the dots from brain to muscle
Sure.
through the spinal cord of how to actually produce that movement.
Right.
Okay, so that's why when I analyze somebody, I watch them squat, and they go down, it looks absolutely horrendous.
Mm-hmm.
Like you've seen it before.
Sure.
The knees kind of cave in,
Oh,
the
yeah.
low back rounds. If you're doing an overhead squat, the arms drop, heels come up off the floor, what have you.
Right.
And then I put them on the table. I try to correlate what I see in the movement pattern to what I'm finding from a joint standpoint.
Sure.
So if that squat looks like crap, put them on the table, and I'm like, oh, you got all the hip range of motion. The ankles look good too. Shoulders are okay. Got to be a motor control issue.
Mm-hmm.
And you know that the number one exercise you could do to pick apart that? Goblet squat, man.
Really?
Goblet squat. You give somebody a heavy kettlebell to hold in front of them,
Mm-hmm.
instantaneously, all that core musculature engages from diaphragm
Mm-hmm.
to pelvic floor to erectors in the back and the TA in the front, and improvement in squat pattern.
Right.
Okay, so now you know, well, we just got to drop the load and start training it from a neuromuscular
Mhm.
standpoint on the way back up from a
Right.
foundational level.
It's really funny that you say that because when people aren't consciously, you have to put them in the mode where you take the brain away from the equation.
Yeah.
Because if you get people trying to compartmentalize movement while doing the movement, 9 times it happens a lot where things just don't happen the way that they're supposed to.
Mm-hmm.
You know, musculature fires out of sequence, and it really, it actually works, backwards and becomes extremely frustrating,
Mm-hmm.
right? And you see it all the time where somebody be warming up, with their clean or whatever, and their position looks amazing. Triceps, upper arms are parallel to the deck, hips are past the knees, posture's right, great thoracic flexion, blah blah, or extension, blah 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 blah. Position is amazing. Then you put them, 80% above, and everything starts to cave in. Their squat's not as deep. They're on their toes, but when they were warming up, they were in their heels, because they're thinking too much. Whereas when they were warming up and it was casual and they didn't have to think about it and there was no stress, there was no external stimulus, you didn't feel like a million eyes were on you because you weren't doing anything impressive, you were able to achieve optimal position. So when you get somebody on the table and they're obviously, experiencing some kind of deficiency because now it's manifesting itself in pain.
Mm-hmm.
On average, how long are you working with somebody before you can kind of get to the point where it's like, a lot of your issues are
mental game, and that the sports psychology field is actually like rapidly evolving and growing because it is such an untapped resource of delving into even personal problems at home, what your environment is, what type of setting you work in, the people you hang out with.
You carry all that with you.
You carry it all.
Yeah.
And you can carry that stress in certain muscle groups. And, people always remember the one about carrying the stress in your traps, right? A lot of people carrying their low back.
Right.
You can get a lot of people with low back pain that you got to get them down from a stressful situation and the low back pain will go away. Okay.
Yeah.
And it's the same thing. We were just talking about this earlier. Somebody coming into the gym every morning and they're always amped up and they're talking to everybody and they're so bubbly and they're banging their head to the music and they're lifting with a smile on their face. And the day they come in and they're just really low to the ground and the head's down and they look real sad or defeated, right? There's something going on and you're going to watch them move and it's not going to look the same as it normally does.
Right.
Right? Maxes aren't going to be there. The movement quality is not going to be there. And that has nothing to do with their physical capacity.
Sure. Right.
It's all what's going on up between the ears.
That's crazy.
Yeah.
From more like a personal, I was just thinking about this on the top of my head now, because I remember I was doing, so to speak, like air squats or overhead squats with no weight on the bar, and my form is complete shit. Like it's like I feel like I'm just tipping or doing this, but as soon as I'm under load, people say, "Man, your form went from shit to like amazing. Your posture is great."
Mm-hmm.
What is that? Is it muscular? Is it mental? Like what is that for?
So that goes back to the whole goblet squat example, right? Under light load, you're not engaging the right musculature because you don't have maybe the motor control standpoint to actually perform the movement pattern correctly, or you're just not a master at that movement yet.
Mm,
Okay, but you add a lot of load to it, and all of a sudden your body's like, "Oh shit, we
Yeah.
gotta work
It lights
together
up.
now and light it
Mhm.
up because otherwise he's gonna freaking kill himself
Right.
or hurt
Right.
himself really bad." Okay, so then you'll see everything start to engage and work
Mhm.
really, really well together.
Well, that's why, like in Oli specifically, we work empty bar, to just to facilitate the flow and movement pattern definition,
Uh-huh.
right? But your position with that empty bar, because there are so many other compensatory mechanisms that you have from your background, and it's different for everybody. Because that bar's so light, you don't have to actively engage everything all the time because you don't have to,
Mhm.
right? That bar, that position is not life or death, right? But you know, if we're hitting singles at 85%, if you want to make that lift, you better turn everything on.
Mhm.
And that's the difference, right? When you don't have to, like, you can literally almost limp
Mhm.
support an empty bar overhead. You put a little bit of load on that thing, you gotta lock that structure in,
Mhm.
you know what I mean, and get that optimal position for it to be comfortable, and B, and more importantly, for it to be a successful lift,
Mm.
right? And that's a lot of the difference. So you hear a lot of people in the CrossFit space, not necessarily the Olympic lifting space, say like, "Oh, you got to put them under load if you want them to do it right." But if you talk to an Olympic lifting coach, they'll tell you the exact opposite.
Mhm.
If you look at the Eastern European camps, if you look at the Chinese and the way that they lift, dude, they play with PVC broomsticks and empty bars for hours, just developing movement patterns and making sure that you're making contact in the same spot over and over and over again. That way, when you do get 80+%, that 300 looks just like a broomstick.
Mhm.
You know what I mean?
Yeah.
So
And
it's
that
sort
goes back to the whole like the 10,000 rep phenomenon, right? You got
Mm-hmm.
to keep moving and moving and moving, practice and practice and practice, and eventually it becomes second nature. But you have to do it with intent
Yes.
because if you go through a movement pattern, just because you're practicing doing a snatch
Mm-hmm.
doesn't mean you're actually getting better at it. Practice doesn't make perfect. Practice makes permanent.
Yes.
So you train a movement pattern crappy,
Mm-hmm.
it's going to be a crappy movement pattern
Forever.
forever because
Yeah.
that's what your central nervous system has just been wired to do.
Mm-hmm.
But and it goes back to the same thing when I'm retraining people to get back into the gym.
Right.
You can do something as simple as a dead bug exercise,
Mm-hmm.
laying on your back, either hands up against the wall or overhead or out in front of you, and doing that reciprocal pattern. People can just go through the motions and think they're doing it right, but if you're not actually like stamping that foot into the wall, pushing your hand back to grab the wall behind you, you're not getting
Mm-hmm.
the actual purpose of the exercise,
Huh.
You
right? And
you can tell the people that warm up with intent because they're sweating their asses off
yeah,
when it's over,
yeah.
and then they're like it's slightly painful, definitely uncomfortable when you're warming up with intention, but then when we get to the lifting, you know what I mean, and you're sticking it and everything feels clean and it's smooth and almost effortless. That initial struggle when you're turning on the system and
Mhm.
getting everything to fire in sequence and going through that process, right? If you approach that with intent, like Matt's saying, you will optimize your performance in that desired lift or
Mhm.
metcon or whatever, because once you improve efficiency, you're using a lot less energy to create the same amount of effort.
Mhm.
And that's I find it beneficial. I don't know if you feel the same. It's like coming from that bodybuilding background, I thought the benefit of having that mirror in front of you is so helpful because you can see when, like, say you're using your left or right shoulder more than one another, you can actually see and you can make that adjustment. Do you find it valuable for people, like a client who's not really aware of they're doing like improper, their scaps are moving, one's moving higher than the other, not contracting? Do you find it valuable to film yourself and then work on those patterns progressively? And
Yeah, 100%.
yeah,
And that goes back to the continuum, right? Are you a novice lifter? Are you intermediate? Are you advanced? Um, Bodybuilding gyms are great for working with novice lifters. You do have those mirrors. It's a visual feedback. I'm a visual learner.
yeah.
I like watching myself do something and kind of picking up on maybe deficiencies I'm using or compensation patterns I'm using and pick it apart and then go from there. But what you'd like to see is a transition from that. Right? You want to get to the point where you no longer need that visual feedback, and now you're feeling it. You're like, oh,
Yes.
yeah, like my hip shifted in that one, or I didn't activate the shoulder on that snatch on the right side. So you got to work towards that, but it depends on the person.
Self-aware.
Yeah, and it goes back to even like the yoga community. Right?
Sure.
Some yoga studios don't have any mirrors in them. Others have the room entirely surrounded by mirrors.
Right.
My wife hates those fucking mirrors, man.
Really?
She's a yoga instructor and she hates those mirrors because
Sure.
she thinks that, I mean, I see her standpoint from it.
She
Like
thinks they're distracting?
yes.
Okay.
Because as an advanced yogi, you should be able to go through all those poses with your eyes closed, man. You
Sure.
should have that stability and that mindset to take yourself through there. And I'll be honest with you, I love those mirrors.
Yeah.
Because yoga is something that I'm still practicing really hard to get better at. And I still consider myself a novice yogi. Like I need to have those mirrors to see what movement patterns I'm doing.
Right.
Because I know from a physical therapy standpoint, if I'm like dumping into my low back or not activating my shoulders during a chaturanga or something like that. But from somebody from her standpoint who's been doing it for over a decade,
Right.
they're useless.
Sure.
Right? She's already made that transition into mastery where she can feel her body go through everything.
That's awesome.
Yeah.
And that's where, you know, you ultimately want to end up. You know, back in college, Coach Hedrick would, as we got into our retraining phase after the season, you know, we would do our Oli face in the mirrors, right? And then after that first phase, we get into hypertrophy, right? And everything thereafter, leading up to preseason, you had to do your Oli facing inboard, so you couldn't use the mirrors and really develop the feel for your lifts and position and be able to identify. He would watch you hit a lift, and then he would ask you a question. What did you feel there? He wouldn't tell you anything that was wrong. He would just, you know, whether it was an amazing lift and you stuck it 100%, or, you know, you shifted to the left as you were coming out of the hole, or you pulled too early or whatever. He would just ask you a question. How did that feel? What do you need to fix on the next lift? And he would make you become conscious of your movement patterns. And that makes you so much better in the long run, because now as you move, you can identify compensatory mechanisms. And when you're doing the extra that we ask you to do, you're able to use focused effort. You know, you don't need to, like you said, do the kettlebell press because you've mastered that. You don't need to do the landmine press because you've already done that. Let's go ahead and, you know, get up on the bar and work through some kips, you know, and create that core engagement and that stabilization in that sense. You can go ahead and graduate straight to that because that's where the work needs to be. But if you don't take the time to identify the deficiencies in your movement, you know, from one rep to the next, you know, that it's that much harder to get to that focused effort. And that's where a lot of people get lost and start spinning their wheels in the process because they're not aware of where they're deficient. You know,
100%. And we all got deficiencies.
every single one of us.
It doesn't matter if it's a mental deficiency, a physical deficiency, an emotional deficiency. We got to work on stuff every day. Just you got to attack it with that intent,
right,
to get it better.
When you look at, you know, how you approach CrossFit and how you recommend people approach CrossFit, this is always something I'm curious of when I talk to other coaches and other professionals in the industry. when it comes to manipulating intensity, would you rather somebody take the day completely off from CrossFit, or would you rather them come in and go through the motions, assuming that there are no inhibitory external factors or anything like that?
Right.
But I'm not with it today.
Mm-hmm.
You know, I'm not gonna hit a PR, but does that mean I should just go climb camelback or do some yoga, or should I come in and dial the intensity back and focus on and devote some focused effort to something else required of me in that class?
And that's where it comes back to the individual basis of
Mhm.
understanding your own body and how you feel.
Yeah.
Like me personally, if I have the intent to go into the gym that day, no matter what I feel, I'm still going to go into the gym. Like you said, if I'm feeling pretty crappy, I'm not getting into PR today, that's okay.
Right.
You just got to be mentally okay with that and accept it.
Sure.
But as long as you're practicing good movement and dialing down the intensity, there is nothing wrong with
Mhm.
doing that. Some days I'll come in and even the workout written up on the board, I'm like, man, I just can't. My shoulders are so beat up. I'm not gonna be able to do that. I'll get on the assault bike and just do calorie sprints.
Mhm.
You're still getting a workout and you're still getting that cardiorespiratory buildup and that lactic acid and all that, and you feel good because you got hot and sweaty. But now you're not potentially causing tissue damage because you don't feel like doing a movement pattern and you're gonna half-ass it.
Mhm.
And that's where you run into trouble about injury prevention and stuff like that.
Right.
Yeah.
Right.
Yeah. But then some days you may feel like really, really crappy. And like, I just need to walk today.
Sure.
My wife Lex does it all the time. She's like, I'm just going to go for a run. I
Mhm.
think that's what my body needs. And she's
Mhm.
really, really good at understanding her body and knowing when to turn it on and when to turn it off.
What are some of the mechanisms you use to help your clients, your athletes, get to the point where they're self-aware that way, where they don't have to, they're proactive in their performance instead of reactionary, where they're waiting for you
Right.
to tell them what to do?
Are you talking from like a recovery standpoint or like
Just to be aware of that whole
Yeah.
phenomenon that we
Yeah.
just talked about.
So there's a couple different easy ways to do it. I like to have people use like a gripper,
Okay.
a simple gripper that you should be able to close. If you wake up that morning and you can't grip it and close it shut, your central nervous system's shot. Okay, grip strength has been shown in the research to be a great indicator of central nervous system fatigue.
Okay.
Okay, there's also heart rate variability that's
Yeah.
getting big on the scene now too. You do not need a crazy contraption to do it. I've got an app on my phone. I just touch the sensor in the morning, laying in bed when I wake up. It tells me my heart rate.
Yeah.
If I know I normally sit between 40 and 50 beats per minute, and I'm jacked up to like 65 or 70,
Right.
central nervous system is not feeling hot today. So let's dial it back a little bit.
Sure.
And those are two real great indicators.
Wow.
And another one too is just general fatigue.
Yeah.
And that can go back to nutrition too. Man, you might not be
Sure.
getting enough carbohydrates, not be getting enough fat to actually fuel your brain.
Mm-hmm.
So that's kind of where it gets tricky between, are you fatigued from a central nervous system standpoint, or are you muscular fatigued?
Right.
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 And that will dictate how you train that day.
Okay. All right.
Interesting.
And I think that's sage advice for people to walk away from this podcast with is, above and beyond optimizing movement and recovering as best you can between workouts from one training session to the next. What what we hope you walk away with from today's show is everything that we're talking about is the facilitation of self-awareness and becoming aware of not only what's going on around you, but what's going on inside of you. So I think that's a good place to stop today. Before we get out of here, I ask everybody this as they come on the show, and you can answer this question in any realm: mental, physical, spiritual, what have you. What's one thing I'm so interested in? We're so interested in your daily routine and what drives you to be the master of your craft that you are. And what we've come to find is that for people who are in that category of mastery, uh, they all have some kind of daily routine. So, what's one thing that you do on a daily basis to feed yourself, kind of get the engine going, light the fire, And then what's something that you do every day to fuel yourself to kind of keep the motivation going and keep the momentum moving in the right direction?
Okay. From the feed me standpoint, I believe that you need to be able to feed yourself, not just physically, but mentally or intellectually and spiritually as well.
Sure.
From a physical standpoint, it's just about having a movement practice.
Mm-hmm.
Okay. Every day I'm doing something, whether it be walking, getting into the gym, hitting it hard, going for a walk with the dogs. I mean, it doesn't matter as long as I'm moving. And I always have to have my mobility practice in
Sure.
at some point. I'm
Okay.
doing 10 to 15 minutes of some kind of mobility work to improve my positions and improve my
Mhm.
tissue quality and my tissue health. From a mental, intellectual standpoint, every day I'm either listening to podcasts, reading a book, reading research papers, something to keep my mind intellectually stimulated.
Yeah.
Okay. And then spiritually, I mean, I am a God. Okay. And we do go to church, but that doesn't mean that you need to do that.
Sure.
There are plenty of times where growing up, I mean, just being in the woods and my dad hunting,
Sure.
that was spiritually enough for me.
Right.
And right now, it's sometimes just laying on the couch with my wife. That's
Mhm.
all I need for that rest and that recovery, just spending some time with her. Because being a businessman now and an
Mhm.
entrepreneur, we don't get a lot of time together, and
Right.
that's something that we always strive to keep.
Sure.
And then that's all the three.
Okay.
Yeah. Anyway, and then from fueling me is doing my job
Okay.
on a daily basis. Waking up every morning and knowing that I'm improving somebody's life that
Mhm.
day or multiple people's lives that day, whether it be through improving movement, nutrition, mentally, just talking to you. Some people just come to talk to me. And I'm okay with that.
Sure.
And that's part of my job too. But that's what keeps me motivated and keeps me going every day to keep diving back into the research and learning new things and going to courses, because the more tools I have in my toolkit, the
Mhm.
better I can help somebody.
Sure.
That's awesome. And then, where can the community follow you and support anything that you have going, whether it's your business, social media,
Mhm.
personal projects?
So my business name is ZPT, so Zanis Physical Therapy, and right now my Instagram is at mzanisdpt, and then on Facebook you just type in Zanis Physical Therapy, and my website landing page is built. The full web page is not up and running yet, but it's zanisphysicaltherapy.com.
Nice, man.
There you go, man.
And you could always find me at CrossFit PHX,
Boom.
throwing down with the big boys. So just come by and say hi. I'm always there in the afternoon, just willing to talk to you guys.
We dig it, man.
Oh,
You
yeah.
know, thank you so much for being on the show. We got so much more out of it than we originally intended. You know, we were um, originally, just expecting, just knowledge bombs.
Mhm.
You know, and we definitely got that. But your whole philosophy about your industry and how you approach your practice, and really diving into what makes you a master at what you do is extremely profound and impressive. So appreciate you sharing that with us.
Yeah. Thank you guys. I appreciate it.
Thanks for coming
Definitely,
on,
man.
brother.
It's been a blast.
By all means, make sure you support the good doctor here, and follow him on Instagram and check out his website. And if you got anything from a kink in your neck to your post-op with some ACL reconstruction, Dr. Matt's got the cure for what ails you. So come check him out at CrossFit PHX. That's his home base now. He's a very crucial part of our family, and we're glad to have him. And as always, for our listeners out there, thank you for allowing us to be a part of your journey. We are super pumped to be a part of yours. And until next time, feel me.
Hey, thanks, guys.
Thanks, man. And that'll do it for today's episode with our special guest, Dr. Matt Zanis. If you want to connect with Matt, please go check out the full show notes at feedmefuelme.com. Also, be sure to connect with us on social media, including Facebook, Snapchat, Instagram, and Twitter at feedmefuelme. We would love to hear from each and every one of you. We're very excited to announce the Feed Me Fuel Me Summit on July 10th, 2017 here in Arizona. Our keynote speaker will be Forrest Lustos. If you haven't had a chance to hear Forrest's story, be sure to check out his episode number 19, Mastering the Superficial and Becoming Exceptional. It's guaranteed to fire you up and make you take action. We'll be releasing event details in the coming weeks on the website and future episodes. We can't wait to meet you all in person. If you found this episode inspiring in any way, please rate, comment, share, and subscribe so we can continue on this journey together. Also, Be sure to share it with your friends and family on social media, including Facebook, Snapchat, Instagram, and Twitter, or any other social platforms that you use. We really appreciate you spending your time with us today and allowing us to join you on your journey. We would love to hear your feedback on this episode, as well as guests and topics for future episodes. To end this episode, we would love to leave you with a quote by Steve Jobs. "The only way to do great work is to love what you do. If you haven't found it yet, keep looking. Don't settle. As with all matters of the heart, you'll know when you find it." Thank you again for joining us, and we'll catch you on the next episode.